we'll keep our tough border policy, including quarantine for those arriving from red list countries. And we will keep the test, trace and isolate system in place. Carl, thanks. Yes, of course, I hope that the roadmap is... Every week that goes by, we're getting hundreds of thousands more jabs into arms, and our delay to the roadmap that we announced last month has enabled us to get 7 million more jabs in the last 4 weeks alone. By next Monday, 2/3 of adults will have received a second dose, and every adult will have been offered a first dose. And it is the single most crucial thing now that you get that jab. A jab that can protect you and your family and allow you, for instance, to go on holiday. And it is, of course, only thanks to the vaccine programme that we are able to take these cautious steps now. But to take these steps, we must be cautious and we must be vaccinated. So please, get that jab. Very much. Sarah from Brighton.
Vaccination reduces the chances that you will catch COVID, that anybody who's vaccinated will have severe COVID or go into hospital, and it also reduces the chances that they will pass on COVID. So it both protects themselves, it protects all of us, and it protects other people as well. So the evidence on vaccinations is overwhelming.
Patrick, anything to add before we go to the public? We will keep all the data under constant review throughout the rest of this year, on probably, I'm afraid, into next year as well. And if we are seeing very exceptional circumstances that you describe, or the arrival of some new variant that we haven't bargained for, budgeted for, that really is causing us a real problem, then obviously we must rule nothing out. And I've been very, very clear about that. We must protect the public, and we will not hesitate to use the means that we have at our disposal. But the way things are working at the moment, we do think that if we are cautious and we go slowly, as Chris has said, that we can continue with the roadmap as it stands. That is our hope. But we hope. Patrick.
Well, there's no doubt that we are in a third wave of infection. Infections are rising rapidly, and I expect them to continue to rise. And the more mixing we have, the more infection is going to spread. So there's no doubt that step 4 will bring increases in spread of infection. And although the relationship between infections and hospitalisation is different, it still exists. So the risk of hospitalisation is something like 4-fold lower than it was, and the risk of death is 9 or 10 times lower than it was, but it still exists. So the models which have been released today clearly show an expectation that infections will continue to rise. If behaviour returns immediately to pre-pandemic levels, that would be a very, very big rise. If we go slowly and cautiously, that will be less of a rise. But we can't escape the fact that any increase like that will be associated with an increase in hospitalisations and sadly with deaths as well.
Could I just add two things to that? One, just to make the point that would be